During the public health emergency, if you were being treated for COVID, most insurance companies covered the cost of that COVID-related medical treatment in full. But now, going in for COVID treatment is just like any other medical visit, and there's a good chance that you will get a bill.
Consumer investigator Kristen Byrne has more on what you can expect to be covered.
Let's first talk about COVID treatment coverage. For anyone who's uninsured, you need to see if your medical provider will agree to bill the federal government for your COVID treatment. Now, for those with health insurance, starting January 1st, most health insurance companies are applying what's called cost sharing to COVID treatment. So what that means is that if you get COVID and you need to be hospitalized, things like your copay, your deductible, your coinsurance, that will now come into play rather than your health insurance covering it at 100%. Here's local insurance advocate Sadie Tuescher.
The vaccine availability and the fact that vaccines are covered at 100% by almost all insurance, there are a couple policies that don't, but most of them, is definitely a contributing factor to this.
Let's address COVID testing coverage. The government is still picking up the tab for COVID testing for those with or without health insurance. Those uninsured still have to go to a state-funded COVID testing site like this one here on Milwaukee's South Side. This is new. For those with health insurance, your private health insurance company is now required to cover the cost of 8 at-home COVID tests per month. And Sadie Tuescher says that testing coverage and more starts to get iffy for those with a short-term medical policy.
That rarely includes testing, immunizations. Some at this point are not covering COVID treatment at all. They're specifically excluding pandemic conditions.
And COVID vaccines continue to be free for anyone living in the United States with or without insurance. The CDC stresses that clinics, pharmacies, or medical providers can't charge you an office visit or an administrative fee if all you're doing is getting a COVID vaccine. I'm consumer investigator Kristen Byrne.